Hello, Stefan. Thank you for accepting my invitation to facilitate a workshop for the International Society of Hypnosis.
Hello, Inayat. It's good to see you again.
Yeah, it's very nice to see you again. I remember that we met in 2018 in Heidelberg in one of the congresses, which was organized by Bernhard Frankl. Am I right?
Yes, yes. We had a good time there, good teaching,
Yes.
good teaching
Yes,
meeting,
exactly.
and also a nice, pleasant time together.
Yes, yes, yes. Great. Okay. Let's talk about the workshop that you're going to facilitate for the ISH. I know the topic of the workshop is integrating hypnosis in psychiatric care. It's very interesting for me because we usually talk about psychotherapy and using hypnosis in psychological settings or clinical psychological settings, but it's the first time that we are going to speak about how we can use hypnosis in psychiatric care. Would you please let us know what are you going to teach us in the workshop?
I would like to share with the participants some of my experience both in the hospital setting, in daycare setting, with group therapy, with ambulatory care, and also treat a topic that is not often talked about, which is mistakes, failures, but also how to integrate it in the general care. You know, okay, we do psychotherapy with patients, okay, we do techniques, we try to facilitate the change process. But usually, once people have a psychiatric disorder, it's already a little bit too late. It's not like therapy alone won't do the job. It usually takes time, effort, both psychotherapy, but also family sessions, but also very often medication. And why not use all that we have at our disposal to make the best outcome? I can give you the example, for example, of the OCD. For the OCD is the only disorder when medication and therapy does better than one of the two alone. So I'd like to discuss with the participants ideas, examples, and maybe some exercises with hypnosis in a second part about the general psychiatric care, not only the psychotherapy.
Great, great. And I know that you are not just a psychiatrist, but you're an artist as well. You play guitar. I know that you write codes. You was a developer for iOS, as I know. So I know you as a genius, as a matter of fact. So I'm really curious to see what you're going to teach us. And I know that you are the deputy director of the Emergence Institute in France. Do you work, do you use hypnosis in, let's say, urgent situations?
You mean urgency, like
Yes,
yeah.
urgency, like medical, I mean psychiatric urgencies.
Yes, I do. I still do night shifts in the emergency room of the general hospital, which often needs a psychiatrist because people come either psychotic or very depressed and suicidal, and sometimes intoxicated. But then my hypnosis interventions are very limited. Sometimes I do use them for reducing acute anxiety when that is the only problem, but it's usually with people who don't have psychiatric problems. Actually, they call me like, can you come see this guy with burns or this guy with acute abdominal pain? Like, can you help them relieve a little bit? Because when someone is in acute psychotic state, like so aggressive that they spit on everybody and bite everybody, I don't spend more than 2 minutes with them. I acknowledge that. I try to talk to them. I give myself 2 minutes to establish a connection. And if I can't do it, I just call the cavalry and say, come on, guys, let's put this person to sleep so that they calm down. And then we give them either medication by mouth or injection, and then we talk a couple hours later. Same thing with intoxicated people. When I see someone with drugs or alcohol, I try to talk to them and speak with them. But if for 5 minutes we can't have a normal conversation, I don't even try. We'll talk tomorrow. Good night.
Okay, okay, got it. Great. So I will be waiting for your workshop. Is there anything else that you want to add in this interview?
Yes, apart from integrating our psychotherapy and hypnosis skills in the whole psychiatric care. There are some points that I wished to share with the participants, but it depends if they're interested or not. One was about the grief process, because in our official psychiatric recommendations, it says that for the first year after someone died, it's normal to be sad and don't do anything. And I don't agree with that. I've learned some techniques which are quite useful even in an acute grief process in the first 3 months, that can actually help people a lot with the separation anxiety they have from the people that died. And the other thing, you said I'm a genius. I don't consider myself as a genius, but I do have one thing that I have managed quite well, is create a separation protocol with patients. Because usually we talk about creating a relationship, creating rapport, but how do we separate? And why should we separate? But sometimes it's good to separate, and it's necessary, or even make a break from the therapy. And when that happens, for people that are very dependent, whatever the reason you have for having to stop treating them, I've created a 4-step program, quite easy, that you can do in 1 or 2 sessions, to say goodbye in such a way that there are no more separation anxiety after that. And so when I leave somewhere, or when I quit a relationship with a patient, I don't have suicidal attempts. Whereas some of my colleagues, they stop seeing a patient, and 2 weeks later, the patient is in the hospital, and they don't even realize that that's connected. But it is, because some people are very dependent on us very quickly. And if participants are interested in that, I'll even tell them some stories about some funny things. But it's funny for me, but it's actually very serious, like sharing a meal or giving each other a gift, anything that could help the separation anxiety through a ritual and a process. And my colleagues at the hospital were very happy about this.
Good, very good experience. Okay, so I invite all the ISH members and even non-ISH members who are psychotherapists and who are interested in this topic. And I know that Stefan is going to have a very useful and practical workshop, because it's not the first time that I'm participating in his workshops. So I invite everybody to join us on Wednesday, and the 3rd Wednesday of October, I mean Wednesday, October 18, from 5 to 8 p.m. Central European Time. Thank you, Stefan. See you in the workshop.
All right.
Bye.
Bye-bye.